Before your trigger finger, your trigger thumb gets so degenerated that you need surgery to fix it, you can remove the adhesion, prevent that from happening by getting treated yourself, by yourself, with the grip bar. Bruce has been a longtime patient of ours at Barefoot Rehab in Denville, New Jersey for various injuries that he's had, and he came in just today and he was telling me about his trigger finger and trigger thumb. He was saying how he had gotten a cortisone shot in his metacarpal phalangeal joint of the thumb, which typically happens when you have pretty severe trigger thumb. And it was a few months back and it relieved the pain for a while, and now it's coming back. And he's like, do I just have to keep getting cortisone shots or what? And I said, no. Let's talk about what a trigger finger or trigger thumb really is. Trigger finger or trigger thumb happens when the flexor tendons going to the thumbs or the fingers end up becoming thickened. And they become thickened and they run through this little pulley system. So imagine a little circle that the tendons have to run through. But if you have two fingers, because your flexor tendons degenerated or thickened, then it won't be able to fit through the pulley, and it can lock and snap and pop and cause a lot of pain and a lot of symptoms. So typical interventions will be ice, heat, physical therapy. If those things don't work, medical doctors will want to inject with cortisone shots, or they will inevitably want to cut the little pulley that's right at this joint of the thumb, or this A1 pulley of the fingers right here, which is typically where trigger finger happens. Unfortunately, none of the papers I was just looking at for trigger finger or trigger thumb talk about the secret cause of trigger finger, trigger thumb, or chronic pain at all, which is adhesion. Adhesion throughout your forearm muscles, your palms, any of the nerves that get entrapped, whether it's the median nerve or interosseous nerve that goes down towards the thumb, or the ulnar nerve or the radial nerve in the back. No one's talking about this stuff. And the good news about you having this problem, as long as you have mild to moderate trigger finger or trigger thumb and not severe trigger finger or trigger thumb, in which you need to come see us at Barefoot Rehab in Denville, New Jersey, because you're not going to be able to treat those nerve entrapments yourself, you could treat yourself if it's a mild to moderate problem with the grip bar. I just found this article called Trigger Thumb on PubMed.gov. It actually came out in February of 2024. So 2 points here. One, I thought the interesting, I didn't even realize this, 2 to 3% of people in their lifetime are gonna get trigger finger. And that goes up to 10% with people with diabetes. Super interesting to me. Especially females aged 40 to 60 are the most commonly people to get trigger finger, trigger thumb. Super interesting. And then the other part of this, which I mentioned a little bit of, treatment or managements. Typically rest for 3 to 4 weeks, avoiding activities that overload it, applying ice to your palm, taking warm water soaks, using nighttime splinting, or incorporating gentle passive thumb movements to maintain mobility. Nowhere in here do they even talk about the secret cause of trigger finger or trigger thumb that we have found at our office at Barefoot Rehab in Denville, New Jersey, which is adhesion. And we've seen this with 9 out of 10 of our patients across the board, that most of them, even though they've been to at least 3 doctors or therapists, have never heard of adhesion. The doctors aren't even talking about it. So that's why this video is so important to me, is that people need to know this adhesion problem exists, and you could start to treat this gluey adhesion stuff with the grip bar. I found this awesome picture. This is the index finger of the right palm. Look at this A1 pulley. Here is the flexor tendon right where B is, that goes down to the index finger. This is typically where trigger finger would happen of any of the fingers, or the thumb, which is right there, right in this spot. So just imagine this tendon grows by 50%, 100% when it's overloaded and it's doing too much work. That's what causes trigger finger. The surgeon is going to want to cut that little pulley in order to unlock the trigger finger. But what also needs to happen, if this load isn't taken off the flexor tendon by removing all of the adhesion from the palm, the tendons themselves, all the stuff in the forearm, the side of the forearm, the back of the forearm and hand, then everything is just going to keep being overloaded and come back. So that's why treating the adhesions is so important. And here's our handy dandy anatomy app. This is somebody's right palm facing down. Here is the thumb over here. Bruce was having pain because his flexor tendon right here at the A1 pulley was being overloaded because his thumb is degenerated. So what I'm going to show you is the treatment that I showed him how to do with the grip bar for this muscle, which is abductor pollicis brevis and flexor pollicis brevis, But typically the tendon that's overloaded right underneath that pulley is the tendon of flexor pollicis longus, which is this muscle in the forearm. So in order to see it, I'm gonna have to take away some layers of the forearm to get to this muscle. You can see how high it goes, almost to the elbow. This flexor pollicis longus. It runs on this side, the thumb side of the forearm, deep here, starts here, goes down this way, and then goes underneath that A1 pulley right there. And I'm gonna show you how you can treat this with the grip bar as well. Bruce today said this at the end of his treatment for his other elbow, and I said, okay, what's going on? And he went in like this with his thumb. He said 4 out of 10 pain. So I said, okay, this is what we're gonna do. We're gonna take the grip bar and you're gonna put it underneath your chin, and then you're gonna put your elbow on your knee. You're gonna take your handy dandy grip bar and you're gonna go like this over abductor pollicis brevis and flexor pollicis brevis. This is this little chicken drumstick right here. And you can hear that grit. So we did this over this little chicken drumstick for about 15 seconds, looking for the grit. And I teach you how to hold the instrument and how to look for grit in our How to Get the Grit Out course that we give you for free when you purchase a grip bar. Did this for about 15 seconds and he went like this with a thumb and he said, oh wow, no symptoms. Now, this was the very first treatment that he did for himself on that tissue. So I said, you're likely going to need to do treatments every second or third day on this to get it better. And that was just flexor pollicis brevis and abductor pollicis brevis. But then he has to treat the palm, the forearms, the side of the forearms, the back of the forearm, which I'm going to show you how to do now. So what you do is you want to check the front of your forearm here. These are the superficial flexors. You put lotion here. You're going to lock your fingers in and go to the end range. And then you're going to take, I usually take this half of the grip bar right here, because I like the angle of this. And now I'm just pulling the grip bar up, looking for grit. With any instrument you might use, you want to make sure that you're getting grit. If you're not getting grit, it's not effective. That's why this grip bar is the most effective tool on the market, which you can get at gripbar.co. I'm looking for grit, and I'm not crushing my tissue. I'm not pushing super hard. I'm trying to amplify the sound with me being as light as possible. That's the superficial flexors all in there. And then I'm gonna wanna get the deep flexors in this corner right here going towards my pinky that you need to do with your elbow bent. So I'll typically do it like this. Obviously, if you're seeing a doctor or a therapist, they're gonna know how to lock this in for you. But if you're treating yourself with a grip bar, you need to get creative. That's what we're doing. So you bring your fingers down, you're gonna put your thumb right in your grip bar right in this area, and you're gonna pull up towards the pinky. And I'm looking for grit. I'm changing my direction, my depth a little bit, my pressure. Again, I teach you how to do this in different body regions in the How to Get the Grit Out course. But I want loud grit. Not because I'm pushing so hard, because there's a lot of adhesion or glue there, and that will help us take load off of the trigger finger or the trigger thumb. And that's the superficial flexors. Then for the palmar fascia, or especially you have trigger finger, not trigger thumb, it's these fingers, you want to get all the palmar fascia, and you also obviously want to get where the degenerated tendon is. I like this angle, something at this height that you can prop against. I don't want to break that, so I'm going to go right to this. So I put my fingers against this, and I want finger extension here. I want to bring tension to the whole palmar fascia so this all pulls tight. This is softer, this is tighter, and I like that. So I want to get all of this palmar fascia right in this area. And I'm going towards the transverse carpal ligament or the median nerve or the carpal tunnel, which is right here. So everything is going towards this direction. And I like to use the point, but you could also use the flat edge here, this half flat edge of the grip bar. And I'm looking for grit. And there's a lot of finesse with this instrument. So I'm constantly changing the instrument, the depth, the angle that I'm holding it, whether it's upright or sideways, in order to see what's the grittiest. Because the loudest grit sound is the most adhesion sound, which means it'll give you the most load taken off of the flexor tendon, the trigger finger or the trigger thumb, and reduce your pain as much as possible. So more grit heard and felt through the instrument means greater pain relief. That's the palmar fascia. Then let's say it's the A1 pulley right at the index finger right here. So I'm gonna get a little bit of lotion, and I wanna treat this degenerated tendon, because remember, if I'm treating this degenerated tendon at this finger, this is the index finger right there. Here's your thumb. This tendon goes like this, and the A1 pulley is like that. But imagine that this tendon is thicker. This extra red line is how thick it's gotten. So now, instead of it being this thick, it's this thick. And that's why it doesn't fit under that pulley anymore. So you want to also inflame this tendon a little bit with the grip bar. So I'm going to take my index finger like this. Find the right depth. And treat the tendon itself. And I'll probably want to go up this finger a little bit. This is hard to do without someone helping me, because I can probably get it up to that height, but that's okay. So you treat the tendon of whichever finger is most irritated or degenerated or triggering as well. And that's only the front side, and then you're going to want to do the back side as well. So we treat all of the extensor side, where the radial nerve lives under here. I put some lotion on. I'm putting my fingers like a fist, like this. And I'm generally using this half side of the grip bar again. And I'm pulling all the way up towards the elbow, the extensor tendon's right here. You hear all that grit. And the awesome thing about using the grip bar is the more you hear grit and the more you feel grit through the metal instrument vibrating, you're immediately going to move your hand around, your fingers, and you should have real-time results. It should immediately feel better. Now, as long as you have mild to moderate trigger finger, you're going to be able to relatively manage it yourself and keep things down by treating these tissues. So usually if you have a bad condition, you probably want to do this twice a week. You don't want to use the grip bar when you're actively irritated or inflamed from using it 2 or 3 days ago. So make sure you recover. And the goal when using the grip bar is maybe that you have a little bit of redness or petechiae, micro bruising, or maybe a little bit of soreness the night of the next day. If you're so sore that 2 or 3 days later, you're like, what did I do? Yeah, you overdid it. You can do too much. You don't really want to do more than 30-ish seconds in an area. And you don't want to be blasting through this by pushing down so hard that you're giving yourself a deep tissue massage with the grip bar. That's not what this is about. It's about finesse. So you want to be soft, get the right tension on the area, and then pull it in order to find the grit. Like I said before, if you have a severe trigger finger, you likely first need to see an adhesion specialist. You can find one at www.findanadhesionprovider.com, and they're going to be able to treat the nerve entrapments that you can't treat with the grip bar. The median nerve in here, the ulnar nerve on this side, or the radial nerve on this side. Because typically when people have trigger finger, there are almost always nerve entrapments that need to be released in order to take stress off of the finger tendon so it stops becoming thick and degenerated. And then if the surgeons want to do cortisone shots or cut the A1 pulley, that comes after you've tried getting all your adhesions removed. So I wouldn't get surgery before you've had your adhesions removed, because they could do the surgery and with all that glue still in your forearms around the nerves, you're going to be really frustrated when nothing has worked for you, and then you're like, what do I do? And then what I'm going to say if you message us is, go to www.findinadhesionprovider.com and find somebody who can help you and fix this. But if you're somebody who has mild to moderate trigger finger or trigger thumb and you're ready to treat yourself and to see if you can get rid of this by yourself, go to gritbar.co. That's gritbar.co. You can purchase this for $100 and get to work. And Bruce just got one today because he saw the results that he did to himself. And now he's going to take care of his thumb. And if he really needs me, then he'll come in the office and I'll remove this nerve entrapments. Go to gritbar.co, try this out, and let us know how it goes in the comments below. If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe, stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.